guys, for today's vlog, we are going to help you know facts about COVID-19, how it is transmitted, how it affects us, and at the same time, how we could stop it from continually spreading in our community. This is COVID 19, an infectious respiratory disease caused by a new strain of coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. Coronaviruses are common in certain species of animals such as cattle and camels. Although the transmission of coronaviruses from animals to humans is rare, this new strain likely came from bats, though one study suggests pangolins may be the origin. The virus is thought to spread mainly between people who are in close contact with one another through respiratory droplets produced when an infected person coughs or sneezes. It also may be possible that a person can get COVID 19 by touching a surface or object that has a virus on it and then touching their own mouth, nose, or possibly their eyes. For most people, the first symptoms will be fever or cough, but some might not even show symptoms at all. Patients who are usually older or have a pre-existing condition are normally the ones who will experience difficulty in breathing or dyspnea. Dyspnea tends to cease after about 13 days for those who survive, though it will continue until point of death for those who didn't.
So, hello guys, good afternoon. Today I am here to answer the question how I feel about COVID-19 and at the same time, how did it affect my normal lifestyle and my lifestyle as a student. So, I believe through these times of grief because of the global pandemic caused by COVID-19, I think that each and every one of us is affected one way or another, may it be directly or indirectly. But as a student, it truly has affected me because of the fact that I am not a student who was raised through this virtual form of education. I was actually a student, and I'm still a student, who is raised through the traditional form, learning lessons through discussions, recitations in one room or in a classroom. But through this, I am actually forced to learn it visually, which is on my part very difficult as I am not a visual learner. I tend to ask questions, I need to hear some explanations about some subjects that is related to our lessons. But at the same time, COVID-19 made me realize that each person in this world should be more adaptable towards any situation that they face. That we should realize that learning and giving off and at the same time taking in lessons for yourself or any student is not limited towards the classroom form of setting. Knowledge will always be everywhere, and at the same time, it is limitless for us to have ways on how we could learn one thing or another. So for me, that is it. I am affected, yes, but it would not stop me to pursue my dream of becoming a pharmacist, and at the same time, it would not stop me to learn. Yes, at times I will complain, but at the same time, my love for education will always thrive, and I will continue to try my best, may it be on online or traditional form of education, to learn in order for me to become a better student. That would be all. Thank you.
As a pharmacy student, how can you help prevent COVID 19 transmission?
As a pharmacy student, I can help prevent the transmission of COVID-19 by being a good role model and educate others in my family and in my community.
about infection prevention basics. This can include performing good hand hygiene, social distancing, and other infection control measures.
As a pharmacy student, there are ways that we could prevent the transmission of COVID-19. Examples are wearing a mask and gloves when you're going outside of the house. If you don't have any mask, use your elbow when you're coughing or sneezing. Always bring alcohol to sanitize your hand if you don't have any gloves, and perform the social distancing. Properly dispose the gloves, tissue, and mask after being used.
As a pharmacy student, what I can do to help prevent the COVID-19 transmission is to always keep myself updated from reliable sources about the disease, and to always follow the preventive measures provided by the World Health Organization, such as practicing proper hand washing, avoiding contact of hands with face, staying at home, and social distancing. I can also apply some of the knowledge I've learned, such as saponification in chemistry, to produce more soaps for my family, if the ingredients are available.